I want to tell you a story about a patient with an infection that used to be rare but is becoming much more common now. In 2016, there was this woman that was admitted to a Nevada hospital because she had a hip infection, and unfortunately, that infection began to spread and she died within the month because of septic shock. The doctors tested that bacteria and it was resistant to every single type of antibiotic that we have available here in the United States. Now, that bacteria was called one of those nightmare bacteria. You might have seen reports about this recently in the news that the CDC saw an increasing trend of this bacteria here in the United States. Combine that with a World Health Organization report that was released last week that showed an increasing trend of antibiotic resistant bacteria happening across the globe and here in the United States. Combine that also with a recent report showing in the next 25 years, we will see 39 million deaths directly attributable to antimicrobial resistant infections. So what has the United States done? Well, Trump has pulled us out of the World Health Organization, and we were one of the leading donors for this organization that did global surveillance efforts that affected us directly here in the United States. Trump has also rescinded billions of dollars of public health funding that went directly to doing surveillance for these types of infections in the United States. And Trump has fired thousands of HHS jobs who's directly overlapped with the people that track these infections in the United States. Combine that as well that the pharma groups are not making antibiotics for these types of infections because there is no federal incentive to create them because they don't make the pharma industry groups profit anymore. So this new report by the World Health Organization is just another warning of the forthcoming global emergency that Trump does not think will affect the United States. But these bacteria know no borders. They're coming here and they are already here in the United States. And we need to have better reinvestment in public health surveillance and interventions to prevent these types of infections from spreading and becoming much more common, like that case study of the 70-year-old woman from Nevada that I told you at the beginning.